The pharmaceutical industry of Bangladesh, they are exporting more than 150 countries worldwide.
So as you were talking about worldwide, being a chairman of this department, I should be very frank to ask you that in global competition, could you please tell us where your students and where the pharmacists of Bangladesh are staying right now?
The pharmacists, they are working, as I told you, that they are working in pharmaceutical industry, in the factory, in the marketing sector, in hospitals, clinicals, and other sectors as well. And our pharmaceutical industry is doing great for last 10, 15, or 20 years. How? Nowadays, they are exporting more than 150 countries. And the most important thing, our need, the total medicine need of our country people, the Bangladesh people, total need, 90% of the total need, they are made by our own pharmaceutical company, our indigenous pharmaceutical company. So it's a huge thing. And if you just check the price of our product, that is also very reasonable for the country or people like us actually. As you know that not all the peoples are having good salary or other things. So
how would you explain the significance of World Pharmacist Day?
As you know, the pharmacists are one of the health professionals who are contributing a lot in today's world actually, not only in our country, in every country actually. So in World Pharmacist Day, this year's theme actually is to think health and think pharmacist. So we need to think about the healthcare system of the society, of the country, and worldwide. And for this, actually, pharmacist has a great role actually to play. And they can, as you know, that pharmacists are not only working in pharmaceutical industry, they are also working in hospital and other clinical pharmacy job, and also in government sectors and other sectors as well. They can at least purchase. Suppose for an example, if you go for paracetamol syrup, it is only 35 dhaka. Pharmacists are the person who are working in those company, in the factory, who are producing quality medicine, assuring the quality of the medicine, and those medicine actually were exporting worldwide, and we are competing with countries like India, China, and all.
So there is a big contribution of the pharmacists.
Big contribution not only in industry, also our pharmacists are working in hospitals and other areas where they are working hand by hand with doctors. So nowadays doctors are saying, okay, because we don't have this practice started not long before, and they are competing for generic marketing. So now most of the generic market product are controlled by India, China, those countries actually. So if you can just get 1% or total 1% of the generic market of the world, then it will be a huge market for us.
So you're going to say that your industry, I mean this pharmacist from Bangladesh, they are exploring themselves in the global market.
Global market, as well as they are developing product, medicine, quality medicine for indigenous people as well. Actually, in first world, this is a process. Pharmacy should work in hospitals, in clinical setup, in community pharmacies as well. Nowadays, it is started in our country, and doctors are also feeling that yes, we need pharmacists in our hospitals and clinical setup, and also in model pharmacy, in the community pharmacies. Those mainly.
But there's a myth that the most of our netizen and most of the people of our country, they know the doctors, the contribution of the doctors, but very few people know about the role of the pharmacists.
Yeah.
So could you rephrase or could you explain what is the role of the pharmacists basically they do?
Basically, if I start with a pharmaceutical company, what they do, when now one company, you have heard already that Incepta and some other companies, they have started producing raw material like APIs and excipients. Few companies already they produce some raw materials like Beximco, but now a large scale production of raw material have started. Few companies are looking for it and started, and from there. In a pharmaceutical company, they start work with product development. When raw materials come, they start mixing API with excipients. They are developing tablet, capsules, different types of dosage form. Not only the conventional dosage form. Nowadays, lots of companies they are developing advanced drug delivery system. They are preparing some nano preparation for anti-cancer delivery, for anti-cancer drugs, for cancer disease treatment, some biological preparation. and also some vaccines their company they are producing or trying to produce. So all those in those sectors are pharmacists. Mainly the pharmacist is the key person who are from developing stage to till finished production, and also marketing of those products. What is the benefit of those products? They inform not only the patient, also the doctors.
বাংলাদেশের প্রথম ইমিউনিটি বুস্টার সমৃদ্ধ ফ্যান্টাস্টিক হ্যাপি এনার্জি বিস্কিট
Why their product is better than other product, or this product, how it will benefit the patient. So in each and every sector they are performing their role to improve the healthcare system of the society and the country actually. Not only this industry sector, in hospital setup, nowadays pharmacists are working as a clinical pharmacist or pharmaceutical. When the doctor give the prescription, pharmacists check the prescription. If there is anything anomalies, or they suggest the doctor, or whether the patient is taking the medication properly or not. Also the suggesting the patient how they should take the medicines, all those things, and also the staff, nurses and other staff, if they have to say anything.
All I got. So finally, I would like to come to talk about as a teacher, you have been teaching your students for a long time.
Yeah.
So how the potential do you see in this?
For North South University Pharmacy?
Yeah, that's true.
Actually, when I was admitted in Jahangirnagar University, I did my graduation in pharmacy from Jahangirnagar University. So one of our teachers is a great teacher, well-known teacher, Dr. Professor Abdul Goni. What he told us at this moment that actually changed our mind actually that moment. What he told us that as a pharmacist you have huge responsibility. If a doctor make a mistake, one patient can die. But if a pharmacist make a mistake during manufacturing of medicine, a batch which contain lots of tablet, so if a batch is with wrong quality product, lots of people can die. So you need to understand your responsibility as a pharmacist. So from that day, actually I understand that what is the role and responsibility of a pharmacist. So we have learned or studied that way. Now as a teacher, I also, or we, the faculties of Department of Pharmaceutical Sciences also teaches in that manner, or with the responsibility, so that our graduates, our pharmacy students can have all the knowledge regarding the manufacturing, quality medicine, as well as the clinical pharmacy and hospital pharmacists and modern pharmacy, all the knowledge they should have. So what we do actually, we have updated curriculum. Mainly we follow US top school of pharmacy curriculum, and we have made our curriculum based on their curriculum, and we have strong faculty pool. We have around 32 faculty members now at this moment. Among those, 22 faculty members are having PhD from USA, UK, Europe. So you can see more than 65% faculties are having PhD. So they are well knowledgeable. They have well training, well expertise, not only in teaching and research. That's why they can train the students or pharmacy graduates will well train up, and also they can train them for doing research. Different sector we are having research in drug delivery, in pharmacological and clinical pharmacy, in AI-based drug discovery. So we have strong faculty pool. We have strong facilities as well. We have state-of-the-art laboratory facilities. We have around 12 laboratories in our department. In the 6th floor, whole floor is laboratory. 4-5 are research laboratory, and around 8 teaching laboratories we have. So we have also a central research facilities. High-tech instruments are there. So they are getting not only the proper knowledge, they are getting the proper facilities here, so that they can come out as a competent pharmacist with ethics and with proper knowledge, and contribute to the society, country, and for the world actually.
To conclude, many of our viewers will watch this interview with you.
Okay.
So would you like to convene a message for the viewers who would like to set out their goal in this sector? I mean,
yeah, actually, thanks for your nice question. Actually, what I want to say that in World Pharmacist Day today, the theme is Think Health and Think as a Pharmacist. So as a pharmacist, what I would like to say, there is a great profession, noble profession. I can join this profession, and you can directly contribute for the society, for the country, and for the world as a healthcare professional. And I would also like to request our government that in all the government hospitals and other hospitals there should be some pharmacists working in, because if the pharmacist can work with doctors, nurses, and other professionals hand by hand, then it will give us better output for the healthcare system.
So you're asking for the facilitation.
Facilitation, there should be some government initiative as well. Otherwise, not all the hospitals will take this as that we have to have pharmacists, and also the government hospitals and like Upazila Health Complex and other. In each and every hospital, at least we should have one pharmacist, one knowledgeable, well-trained pharmacist.
Thank you very much, Chairman, for joining with us.
Thank you for your